Hi everyone. Today in this video let us discuss the important facts about metformin. Metformin is one of the widely used anti-diabetic agents that is used to control type 2 diabetes mellitus. It has few advantages. First, it increases the insulin sensitivity. Second, it does not produce weight gain, instead it can reduce the weight. Third, it does not produce significant hypoglycemia compared with other antidiabetic agents. However, metformin has few limitations and it may be carefully used in few conditions. This video answers few questions about metformin. What is the effect of iodinated contrast media? Why should metformin be discontinued before the surgery? What is the effect of metformin on vitamins and minerals? What are the symptoms of lactic acidosis and how is metformin producing it? All such facts we will discuss in this video. What is its effect on hypoglycemia? Metformin does not directly increase the insulin release. It acts by increasing the insulin sensitivity and decreasing the hepatic glucose production. That's why it is one of the drugs of choice for the treatment of diabetes and it is the first drug that is going to be used. However, in order to control the glucose levels, it may be given with other drugs in combination. Even though metformin is not directly increasing the insulin release, it can still produce hypoglycemia when it is given with other medications that again increase insulin release. Generally, metformin may be combined with sulfonylureas. In such conditions, symptoms of hypoglycemia should be closely monitored. Effect of dehydration. In people who are having severe restriction of food or fluid intake, use of metformin is not recommended. Particularly during the surgery, dietary restrictions are common, which may reduce the intake of fluids. This may lead to volume depletion and hypotension. In such conditions, metformin may be temporarily discontinued and replaced by insulin therapy. What is its effect on vitamins and minerals? Metformin can reduce vitamin B12 absorption. So, chronic use of metformin may lead to vitamin B12 deficiency. Similarly, this medication can also reduce the calcium absorption. Therefore, after a prolonged period of treatment, such as 1 year, the deficiency of vitamin B12 and calcium may be observed. It is better to monitor these levels when this medication is used for chronic periods. Iodinated contrast media. Before an iodinated contrast imaging procedure, metformin should be avoided. Iodinated contrast media can induce kidney dysfunction and acute kidney injury. As metformin is mainly excreted through the kidneys, this may severely raise the levels of this medication in the body. It can induce serious lactic acidosis, particularly in people with eGFR in between 30 to 60 ml per minute. The risk may be more pronounced. Therefore, before starting iodinated contrast media, metformin should be temporarily discontinued for at least 48 hours. After 48 hours, again eGFR should be reassessed and metformin can be reinitiated in case of stable renal functionality. Use in elders. In people with age above 80 years, metformin should not be started before assessing renal functionality. When the creatinine clearance is less than 45 ml per minute, metformin should not be used. This may increase the risk of developing lactic acidosis. How metformin causes lactic acidosis? Even though rare, metformin can produce one of the conditions called lactic acidosis. It is due to the elevation of metformin levels in the body, which results in the increased levels of lactic acid. Lactic acidosis is characterized by elevated levels of blood lactate above 5 millimoles per liter and a decrease in the blood pH along with electrolyte disturbances. Generally, lactic acidosis can be observed when your metformin levels in the plasma are above 5 micrograms per ml. The risk of lactic acidosis may be increased with age. Particularly, it can be observed in the elders with age greater than 65 years. Use of metformin in people with renal impairment again increase the incidence of this condition. The risk can also be increased with use of other drugs like carbonic anhydrase inhibitors. This enzyme is important for lactate uptake into the liver and it increases the glucose production. Estrizolamide is a carbonic anhydrase inhibitor that prevents this process leading to elevation in the lactate levels. Few anti-epileptic drugs like topiramate also have inhibitory activity on carbonic anhydrase enzyme. Therefore, it may increase the risk of lactic acidosis when it is combined with metformin. Radiological procedures can also produce hypoxia as well as hypotension, and they may also increase the risk of lactic acidosis. In people with acute congestive heart failure, hypoxic conditions can be produced, which may again increase the risk of lactic acidosis. Other conditions like cardiovascular collapse and acute myocardial infarction can also result in this condition. People with lactic acidosis may have few symptoms like muscle pains, increased sleepiness, respiratory distress, malaise, and abdominal discomfort. The body temperature may be reduced along with the decreased heart rate and hypotension. In people with chronic alcoholism, again, the risk may be more elevated. Sepsis is a condition that results in the loss of body fluids, leading to severe dehydration. This may impair renal functionality and increase the metformin levels, leading to lactic acidosis. In case of elevated levels of metformin, the risk of fatal complications can be reduced by using dialysis. Where it should be avoided. In people with congestive heart failure, diabetic ketoacidosis, severe renal disease with eGFR less than 30 ml per minute, and abnormal creatinine clearance levels, and in women with lactation, this drug should be avoided. How does metformin work? Metformin decreases the hepatic glucose production. It also increases the uptake of glucose into the liver as well as muscle. One of its main actions is to increase the insulin sensitivity. What are the side effects? The important side effects are related to the gastrointestinal system. It mainly produces diarrhea, nausea, and vomiting. Abdominal pain, dyspepsia, and flatulence are also common. Other side effects like dizziness, headache, and upper respiratory tract infections can be observed. It can also produce some taste disturbances in the people. How to take metformin? Metformin is available as an immediate release tablets as well as extended release tablets. The extended release tablet should not be broken or chewed as it may suddenly release the medication. The dose of metformin depends on many of the conditions like how elevated glucose levels are, what are the medications that are going to be used, and what the age and renal functionality of the patient. Generally, the extended release metformin tablets are taken at the evening meal at a dose of 500 mg. The dose may be slowly escalated after a few weeks. In case of immediate release tablets, they can be taken either 500 mg 2 times a day or 850 mg once a day with evening meals. Metformin can also be used to control polycystic ovary syndrome as this medication increases ovulation. So these are the important facts about this medication metformin. I hope this video is useful to you. If you really like this video, please subscribe to our channel and share this video with your friends. Post your comments in the comment box. Thanks for watching. See you in the next video.